I see all sorts of women, every age, and there is a common thread of, I am not happy with my body. I have gained weight and I don't know how to lose it. I think I have a hormone imbalance. I hear this every day from almost every single patient, and no one's happy. And there is no magic to this except how do we find this balance in people? And I'm always looking for the thing that can help my patients. Now, of course, the most important thing is it safe? Is it effective? And those are two criteria that I have when I'm looking for ways to help people with the problems that they have. And I think this supplement actually answers that question. Yeah, it is safe and effective.
People are frustrated when they're overweight. They don't want to be overweight. They don't choose to be overweight. And a lot of people out there say, well, it's your choice and you can do something about it. That may or may not be true. They may need help. And what attracted me to this product was it's a simple way for people using the science to get their bodies to drop that fat that they don't want and use it as fuel instead of something that is sticking to them that they don't want to keep. It's going to help them in a very easy way, and it's going to help you correct a lot of things that you're doing wrong.
Hey, I'm Dr. Stephanie Remka. I'm in private practice in Atlanta for over 20 years. I specialize in brain-based disorders that lead to mental health diagnoses. And although weight loss isn't my specialty, it plays a huge part in the things that I see in practice, such as anxiety and depression, PTSD, traumatic brain injuries, post-concussive syndrome. As the body inflames with increased adiposity, so does the brain inflammation. It leads to more deranged behaviors and disordered thinking. So when something came along into my life saying there's an easier way I might be able to help some of my patients manage and balance their hormones by signaling brain communication, and it's only 2 natural ingredients of plant fibers and fatty acids, my ears perked up. Then when I heard there was a double-blind, placebo-controlled study out of the Human Performance Lab at UConn, I said, I got to read everything you got. You got me. So then I brought a bunch of my friends in who are probably smarter than me. And I said, what do you think about this? And here's what they had to say.
Well, what I really love about this product that immediately drew me to it was the fact that it is a patented, clinically validated, double-blind, placebo-studied product. The results were stunning. Seldom do you see something that has such an impact for so many people. I mean, the research just blew me away. And I said to myself, if this product is half as good as what the research says, then I cannot go wrong. And
so utilizing a product like Zenith that can help you reduce leptin resistance, thereby cutting back your weight, which thereby reducing insulin resistance, which is another critical factor associated with so many health problems, from diabetes to cancer, what have you. This is something that I'm looking forward to help my patients and future patients that I treat as well.
Well, when I was told about this product, I started looking at the research, looking at the clinical studies, and I was really blown away because I work with the brain. I'm looking at signals. So if this product is actually doing what it says it does, and it can lower leptin, raise adiponectin, and get the hormones in balance, the fat is going to start to release naturally anyway. So, people ask, why do I gain and lose the same 15 pounds over and over again? Why do I feel hijacked by my fat? Well, now I can tell them it may not be their fault. Based on this research, I think they're going to be able to release their fat naturally. When they do that, they're going to feel better about themselves. They're going to be better parents, spouses, friends. Their anxiety and depression are going to be less because they're going to feel better about themselves.
The success that people were having in a relatively short period of time was very attractive. And people that had taken the product in the study, they enjoyed the product, was easy for them to take, and it was easy for them to follow, and they were continuing to have success.
What excited you about the company and the opportunity to have a little bit more financial success in your life?
When it comes to weight loss, people are confused. They don't really know what to do, and that's not their fault. I think confusion is at the root of all of this. And what I love about what we've got here is something that is simple. If you do it, you'll get a result. I'm that confident in the science. I thought, why not get paid to help make people's lives better? Who wouldn't want that?
I have enjoyed working with these people in the past, and I know their background. I know their ethical stature, and that's important to me. Okay, so I like that. The other thing is getting in to a company early. Sure, you have your growing pains, but there's a lot of rewards with that. It's kind of like watching a child grow up. And that's what's so cool about starting with a company at the ground floor. I'm jumping in with both feet because that's what I do. I know that there's something innately good about what's going on here, and I'm all for that.
I think to me, it really was about saying, you know what? I can help people that I love, my fellow peers, and I can help them help the people they love in their local communities. And together, right, we can all enjoy some greater connection, some fun, some, of course, extra cash flow is always great. Who doesn't love that? So, it created a new shift in energy, opportunity just to share something positive. It's a pay it forward, feel good type of situation.
I think the company of itself and the concept behind it is huge. But on top of that, even more so, I love the fact that we have a person that has gone through, some of the challenges and actually walked away from a significant income to create something better, because of the quality of the relationships that she has with the people coming on board. So now is the opportunity to give back and grow and expand into something that's going to be dynamic in so many different ways.
The combination of who our owner is combined with what she is going to bring to the field, the compensation plan, I think it all came together very, very well.
I personally know and have worked with the founder of this company. I think this product is different because she really wants to help inspire others and help people be the best they can be. I love this community that she's building. So it's going to give them an opportunity to work with others and not feel like they're by themselves.
Well, these are the doctors on my team and what they have to say about it.
Hi, I'm Dr. Cindy Hall. I am a gynecologist. I'm an osteopath as well. And so I practice osteopathic medicine, but I also do surgery. And I am a women's specialist. And I specialize in hormones and in just taking care of women in all phases of their life. And I live in Central Colorado, and I've always been interested in alternative medicine because I feel like there is a way to incorporate everything to get everybody better and have the body get better too.
So I'm Dr. Dave Carpenter. I'm a retired physician, and my practice was called Path to Health. It's in Idaho Falls. And I was mostly into integrative and holistic medicine as a clinician. I did naturopathy, licensed acupuncturist as well. And just really, my whole goal was to help people figure out what they were doing wrong, correct it, and help them get better.
Hi, I'm Dr. Vincent DeFiore. I've been in practice for approximately 41 years. My practice has basically been everything from rehabilitative medicine to holistic healthcare. Basically, at the time that I'm involved right now, I'm doing more in the functional aspect of holistic health and less rehabilitation and trauma care. I've had certifications in everything from a diplomate status from the American Academy of Medical Legal Professionals dealing with trauma care and injuries, manipulation of their anesthesia. But what I love to do is help people get healthy and stay healthy.
Hi, I'm Dr. Melissa Peterson. I'm the founder of the Human Longevity Institute. For more than 25 years, I've been in clinical practice, specializing in health and human potential, really helping people to slow down, reverse biological aging so they can live better longer.
So I practiced podiatry for almost 30 years. My practice was a little different in that I did a lot of surgery, foot and ankle surgery, but I specialized in something that was the treatment of onychomycosis.
My name is Carrie Cater, and I've been in practice for 20 years. I practice mostly holistic medicine, acupuncture. I also do a neurological integration system. So I'm looking at disconnects between the brain and the body, instructing the brain how to repair signals.
So now that you heard some of my friends, and they're amazing, humans and doctors, I hope you're interested in learning a little bit more about what this incredible natural supplement with a proven track record in human clinical trial can do for you and your patients. Please get back to the person who sent you this video, and we can have a further conversation on how we can help you get better results for not only your patients, but your practice.